PowerPoint we'll be covering the occipital bone and the temporal bone. With the occipital bone, we're looking at a lateral view here. Up top is the squamous portion. Coming down is your inion or your external occipital protuberance. Below is your foramen magnum, and here is your occipital condyles for articulation with the atlas. So that's where it connects to the spine. This is your basilar portion, what I refer to as your clivus, and then your hypoglossal canal. You can't really see on this image, but that's the holes on either side of the foramen magnum. So, looking at a coronal slice of the occipital bone, this is a CT scan. We have the hypoglossal canal on either side here. Your jugular fossa, there's some contrast in there so you can actually see the jugular fossa quite nicely. Your atlanto-occipital joint with your dens sticking up right there. This is your lateral mass of C1 and your occipital condyle. Your temporal bone is here, and that's your mastoid air cells within it. So this is an oblique view of CT. You can see it coming through right here, and this is the level that it is at over here. So we're looking at basically the floor coming through here. Here's your petrous or your pterygoid process with your coronoid process of your mandible here. This is your occipital condyle, and here's your foramen magnum. This is a piece of your clivus there. Now this is just a little snippet of a free-floating bone. That's your styloid process of your temporal bone. This is your ramus of your mandible, and this is your sphenoid sinus there. Looking up a little bit closer, we have ethmoid air cells. This is coming up higher. This is a good shot of the floor of the skull. So here's your ethmoid air cells, sphenoid there. Now your condyle of your mandible throws you guys for some reason. So here you can see on either side it's a bone pointing out. So if you see that on your images, that is actually the condyle of your mandible. Here's your clivus, your foramen magnum here, and your hypoglossal canal on either side is open. This is your temporal bone, but it's actually your mastoid air cells of your temporal bone. So I'd expect you to be able to label that. This is your occipital bone back here, and your zygomatic process with your zygoma up top. Here is a sagittal view of the occipital bone. Here's your internal occipital protuberance with your external occipital protuberance. And I'd like you to know your foramen magnum here with your clivus, your sphenoid sinus. This is your sella turcica and your dorsum sella. This is a great view. I think I actually have this image as one of your test questions for labeling. And we have foramen lacerum. It's not a great shot of it there, but this is your carotid canal coming across. You can see it looks like a vessel lies within that on either side. So that is your carotid canal. I wouldn't have you label the station 2, but that's actually a really good picture of it right there. This is your EAM with your mastoid air cells. Here's your inion on the inside. You can see it's protruding in. Your jugular fossa is there, and I would like you to be able to label your zygomatic process also. So here's your sphenoid, these are your ethmoids. So your temporal bone, here's your squamous portion. You have your external auditory meatus with your mastoid portion with your mastoid process. Styloid process coming down, tympanic region, mandibular fossa here, and articular tubercle there. This, of course, is your zygomatic process. Here is a sagittal view. This is a CT. We don't normally do CT scans of the TMJs. It's usually MRI. So if they're not able to do MRI, then we'll do the CT. You'll see here the mandibular fossa with the mastoid atrium and your EAM mastoid air cells in the back. And this is your mandibular condyle. And here is your articular tubercle. Okay, so here I'd like you to know your clivus, your mandibular condyle, your EAM, jugular foramen, it's actually there. We have your carotid canal on either side, so this is really good, or your jugular fossa, foramen, either one, I don't care. So here's your jugular fossa with your carotid canal. So same thing on this side, it's cut, not exactly straight, so you can see it perfectly on the other side compared to this side. Here's your mastoid air cells, your internal occipital protuberance, and this is your occipital bone. Mastoid air cells again, so here's your jugular fossa with your carotid canal and your foramen lacerum. It's a better shot of it there. You can see your spinosum there and your foramen ovale. And here is your pterygoid process, zygomatic arch. As you know, this is your maxillary sinuses on either side. Meckel's cave. Okay, so when we are looking at scans, and this is your sphenoid sinus here, so it's important to be able to look at this little area. You can see this little hyperdense line and hypodensity on the inside of that. A lot of blood will accumulate there, tumors will grow there. So if you're reading a report or see some kind of pathology, you can refer and say, oh yeah, that's within the Meckel's cave. So it's a landmark that the radiologists use quite a bit. The carotid canal comes up on either side, and this is your sella turcica. So your pituitary sits right in there. And you can see up here, we'll talk about that when we get to the brain and what this area is called. Coming through, we have, of course, your temporal bone. If you call this your Petrus pyramid or Petrus ridge, I'm fine with that. And your lambdoidal suture is on either side. This is, of course, your inion. You can see how it's sticking in. Easy, easy. So the inner ear, this is not so easy. So we have the external, the middle, and the internal ear. Within the internal ear, we have your semicircular canals. There's posterior, I say posterior, anterior, and lateral, but it's superior or anterior. You can label it either way. Here's your temporal bone, or your Petrus portion of your temporal bone. Vestibular complex, cochlea. I want you to know your stapes, your round window, your auditory tube. That one slide back a few showed that really well. You have your incus and your tympanic membrane, important to know. And then of course your external auditory canal. So here's an up close picture. You can see your superior anterior, posterior, and your lateral with your round window and your oval window. So round window is round, oval window is oval, and you'll be able to see that on some of the images. And of course your cochlea. This is an MRI. This is a T2 weighted. It's got some special effects to it though. Here is your CPAC. So I won't make you spell out the whole thing. So it's cerebellopontoon angle cistern. So it's this bright area coming all the way around. So that is your CPAC. You can see your cochlea and your vestibule and your semicircular canals. And here's your IAC. Now a lot of nerve sheath tumors grow within this portion, anywhere in the CPAC and along these nerves. So you can see cranial nerves 7 and 8. Those are the only two that I'm going to make you know, 7 and 8. Okay, looking here, we have the inner ear, the middle ear, and the external ear. So you can see the 3 different regions. Semicircular canals, a little hard to see with your vestibule, tympanic membrane, and your cochlea. There are better images that we'll look at. The one area that used to catch me up all the time, and it gets you guys too, is this little sac here. So you can see cranial nerves 7 and 8 with your semicircular canal. Right at the end of the pigtail of the semicircular canal is your endolymphatic sac. It's just a little lymph node within there. Sometimes they get really big and it looks like they have a huge tumor. So this is a little bit better of a picture. This is a CT. We put it in bone windows. When you do your CT course, you'll understand what I'm talking about when I say that. It gives it an edge to the bone so we can see the bony detail really well. The carotid canal, your tympanic cavity with your tympanic membrane. You can actually see the membrane right across there. And this is your external auditory meatus. And this here, remember, it's going out. The bone is pointing out, so it's your mandibular condyle. Another view here, we have your foramen spinosum, foramen ovale, your carotid canal it's here, but it comes up as we go higher. You'll see it cut across like I was showing. Clivus, middle ear, and this is your tympanic cavity, and your EAM, mandibular condyle. Your Eustachian tube, I wouldn't have you label that, it's too small. Mastoid air cells, malleus, and your cochlea. It's a great shot of it, look at it. You can see it perfectly. Tympanic membrane, you see the tympanic membrane on MRI, very difficult to see on CT. And here's your EAM. All right, so we'll cover facial bones next.